Today I'll be doing a marking for BBL case, which is a Brazilian butt lift. The BBL surgery basically comprises of liposuction and lipofilling. The liposuction is done in the abdomen, the back and the outer thighs, and lipofilling is done in the hip dips. So basically it is done to attain an hourglass figure and a protrusion of the butt area, also the correction of the hip dips. So here we have our lovely patient here. So I'll be starting the markings on the abdomen first. Can you just lift this up a little? Yes. So we start the markings in the abdomen. The midline is marked. The maximum protrusion area is marked. That's the breast fold. So all this fat is going to be taken out. This lower abdominal bulge is going to be removed, the upper abdominal bulge is going to be removed. Now, although she has a little bit of laxity, but we're not planning an abdominoplasty as yet. The ideal in her case should have been an abdominoplasty, but still, even with the liposuction, we will be able to get a very nice and flat tummy because her skin quality is very good. It's very elastic and it is likely to retract very well. Then the shaping of the waist is also a part of the BBL surgery. Here we can see that she's got an outer bulge and also this love handle bulge, which is kind of it's hiding the waistline. So we'll bring out the waistline by liposuction of this bulge and this area. Can you turn around please? Yeah. Now from the back, when you see her, a little more. Yes. From the back, when you see her, we can see these bra rolls, the upper back fat, the lower love handle fat. Of course, in a classical BBL case, the upper back is usually not done, but in her case, since it is a requirement and for overall betterment of the figure, we will be doing the upper back as well as the lower back in her case. And you can see that as soon as we do the liposuction of this area, it automatically improves. This bulge goes away and this automatically the figure improves. So definitely the whole side is needed to be done, and a little bit of the outer thighs may be needed, and the hip dips, basically the lipofilling is done in this part. So we go forward and do the markings for this. Entire of this area will be done. The entire of this whole bulge that is protruding will be done. This bra roll. Now we also have to make note that these are there are slight depressions, so we will need to make note of these depressions also, that they do not become more prominent with the surgery. So we have to be careful. Feeling ticklish, huh? So we'll be doing this bulge entirely. I mark the peaks. So this is the peak of the bulge, which has to be done really well to bring out the result. And again the peak here. So this goes until here and until here. So the entire of this bulge needs to be taken down. Of course, this is the hip dip area that I'm marking. A little of the outer thigh area, although there's not much here, but still for the completeness of the procedure. So this side is a little more rounder than this side, is a little flatter. All of us have a little asymmetry in us, and of course we plan to make it as symmetrical as possible, but there's a little bit of asymmetry in all of us, and which is natural and should be acceptable, but still we go ahead and make it as symmetrical as possible. So you can see this is a little more bulge, this is a little flatter. We're going to correct that, and this is the area of the hip dip that is going to be filled in with fat. So also the butt area, basically this area is what we are going to fill in. So this area, outer area, is going to be filled. This outer area is going to be filled, and of course this area here is going to be filled. So the filling will be in this area so that the bud becomes more rounder and perkier. This goes in, this goes in, and this goes in. That is how the waist shaping comes in this case. So I'll be going ahead and marking the areas of filling in another color so that it's more clear. This is the area of the filling. This entire area needs to be filled. And of course the peaks of this, they need to be brought down. I'll just mark them as red rounds so that I'm able to tackle them in a more aggressive manner. So this entire area, and that is how the waist shaping will come in her case. The fat harvested has to be filtered, and then it will be used, it will be purified, and then it will be used to inject into these areas. And it is just under the subcutaneous plane. I do not inject under the muscle for the safety. And I'm hoping approximately about 550 ml of fat should be enough for her. She's got a tight skin, so we'll have to make some space for the fat filling in her case. So we've seen the markings of the BBL, and we'll be proceeding to the operating room now. BBL is a very common procedure as such in aesthetic surgery practice world over, and the results of this procedure basically depend on a lot of factors. You know, how well the fat is harvested, how well we are able to utilize that fat, what is the quality of the fat, what is also the quality of the skin that is going to retract and drape. So if we are dealing with a loose skin which is non-elastic, which will not retract, so then that kind of it jeopardizes the result. So patient selection is a very important factor in the BBL surgery. So we'll be going to the operating room now, and as we head towards the operating room, the patient has already met the anesthesiologist, and she's been already taken in the theatre. And usually it is my habit to be with the patient when they are being put under, because they have a sense of security. Now that she is under, I'll be heading to the scrub area, and then I'll come back for the surgery. Scrubbing is the first step to maintaining the safety of the procedure, and all the surgeons, they are very, very diligent about this process. And we generally, before every case, we scrub for about 5 minutes to clean and actually maintain asepsis for the procedure. So this is a very, very important step where we clean our hands according to the WHO protocol, the 7 steps of cleaning of the hands.